Hi all. This is Dr. Bharti Singh, gynecologist from Bharti Women and Child Clinic. As part of swasti patient awareness series, today we are going to discuss about gynecological cancers. Gynecological cancers are nothing but the cancers arising from women's womb and the organs surrounding it. They include cervical cancer, endometrial cancer, vulval and vaginal cancer, ovarian cancer, and one more cancer which is really troubling all of us is breast cancer. Let's start talking about the cervical cancer. It's nothing but the cancer arising from the mouth of the uterus called cervix. Abnormal growth of the cells due to HPV infection mostly. It's a virus. So what we do as a part of screening procedure, we take pap smears or liquid-based cytology called LBC or HPV detection itself to find out whether you have an infection, whether you will develop cancers in future. This pap smear or LBC is offered for women from 25 years of age to 64 years of age once in 3 years or 5 years depending on the type of test you are taking. Next comes the endometrial cancer. Endometrial cancer is nothing but the abnormal growth of cell from the lining of uterus called endometrium. Usually it happens in an older age, menopausal age, but no age is untouched. Any kind of abnormal uterine bleeding, loss of weight, or any bleeding after menopause should raise a suspicion and you should go to a doctor to seek guidance. Once you meet your doctor might advise you to take an ultrasound pelvis, that is ultrasound of your abdomen and uterus, or advise you to take an endometrial biopsy. Next comes the ovarian cancer. Ovarian cancers have a strong genetic history. So anyone having a history of ovarian cancer in their family should go and discuss with their doctors about it. Patients can have symptoms like abdominal pain, a big tummy, lower abdominal heaviness feeling, abnormal uterine bleeding, loss of hunger, loss of weight. Any of these symptoms, you should go to your doctor and seek advice and examination. For high-risk patients, we do have a screening program where we do a group of blood tests and ultrasound of your abdomen and your organs to find out any ovarian cancer. Next are the vaginal and vulval cancer, which are very rare, mostly seen above 60 years of age. But again, said all that, if you see any abnormal discoloration, any mass growing down there, any abnormal white discharge, you should seek your doctor's advice. Coming to the breast cancers. Breast cancers are now one of the leading cause of morbidity and mortality in Indian women also. Breast cancers are also causing cancerophobia among women. You can definitely prevent it. How? You should do something called as breast self-examination, preferably after your periods. Your doctor will talk to you about it. Anytime you feel a mass, a lump, a change in your breast color, a change in the nipples, any discharge, you should seek your doctor's advice immediately. Also, we have a screening program from 40 years onwards for all women. Usually from 40 to 44 years of age, we ask for optional mammogram. Mammogram is nothing but it is an X-ray of your breast, which can detect or even diagnose breast cancers. From 45 years of age till 64 years of age, yearly mammograms are advised. After that, you can shift to 2 yearly mammograms. For more guidance regarding the same, we are at your reach at Bharati Women and Child Clinic, Pune Rajpuram, Coimbatore. Have a nice day.
Hello, I'm Dr. Parvati, consultant psychologist. Today, we're going to see about facing your fears about cancer. There is a classification of anxiety disorder called cancerophobia, which is a chronic fear of developing cancer. Cancer has long inspired fear, but the effect of fear is not well understood. For the fear of cancer may facilitate or even deter early detection and treatment. Every time you come across a loved one, a relative, or a friend being affected by cancer, there is this fear that pops up and gives you anxiety. Today, we are going to see about how to deal with this fear of cancerophobia with 4 quick tips. The first tip is trust is the heart of all relationship. One with your doctor is no different. The best person you can talk to about your doubts, clarify your doubts, is your doctor. So talk to your doctor and seek clarification is a great idea to live in clarity than to live with fear. Use the internet wisely because internet is a double-edged sword which could either pump up your anxiety or it could even make it worse. Be proactive, for most of the cancers are easily early detectable and preventable. So be mindful of your symptoms but do not obsess about it. Last and the most important, seek counseling. Be relieved, live a life with clarity and wise guidance. Hope this tips helps you. Have a healthy life. Thank you.